Seniors check this while taking supplements at night. The supplement you take at night may seem like the safest part of your health routine. It may be a vitamin, a mineral, a sleep gummy, or an herbal capsule. It may even say natural on the label. But the most important question is not whether the product is natural. It is whether that product fits safely with your medicines, your health conditions, your evening meal, and the way your body changes after 60. That is why tonight's message is not never take supplements at night. Some supplements are useful when they are needed and chosen carefully. The message is simpler and more practical. Before you swallow any supplement at bedtime, check 5 things. The final check is the one that can prevent the most serious mistake, because it looks beyond the bottle and considers the whole person taking it. As we get older, many of us take more prescriptions, over-the-counter medicines, and supplements than we did in younger years. The kidneys and liver may process certain substances differently. We may also be more sensitive to drowsiness, dizziness, low blood pressure, and balance problems. A product that seems mild on its own can become a problem when it is added to a crowded nighttime routine. Before we begin, do not stop a supplement that was prescribed for a diagnosed deficiency or medical condition because of this video. Iron, vitamin B12, calcium, vitamin D, and other supplements are sometimes part of a specific treatment plan. The goal is to review the plan, not to make sudden changes without guidance. Here is the first useful idea. The best time to take a supplement is not automatically morning or night. Timing depends on why you are taking it, what form it is, whether it needs food, what medicines you use, and how it affects you personally. A bedtime rule copied from a friend or a social media post may not fit your situation. Think about your own evening routine. Do you take one supplement, several supplements, or a combined sleep product? You can share only the number in the comments. Do not post private medical details. The purpose is simply to notice how easily one product can become 4 or 5. The 5th check is the reason you are taking it. This sounds obvious, but many supplements enter the routine without a clear purpose. Someone hears that magnesium is good for sleep. A friend recommends melatonin. An advertisement suggests a night detox. A bottle promises calm, memory support, immunity, or healthy aging. The product goes into the cabinet, and months later, nobody remembers why it was started. Ask one direct question. What specific problem am I trying to solve? If the answer is poor sleep, first identify the sleep problem. Are you unable to fall asleep? Are you waking to urinate? Are you snoring loudly? Do your legs feel restless? Are pain, anxiety, reflux, hot flashes, or late caffeine disturbing you? A supplement aimed at making you sleepy will not correct sleep apnea, uncontrolled pain, or a medicine that causes nighttime urination. Melatonin is a good example. It is often treated like a universal sleeping pill, but it is a hormone involved in sleep timing. It may be useful for certain circadian timing problems and jet lag, while evidence for chronic insomnia is more limited. Short-term use appears reasonably safe for many people, but long-term safety is not well established. In older adults, melatonin may remain active longer and contribute to daytime drowsiness. That does not mean melatonin is always wrong. It means the reason, timing, product, and person matter. If you wake unrefreshed despite taking it, or if the dose has slowly increased, that is a good reason for a review rather than simply adding another sleep ingredient. The same principle applies to minerals. Taking iron for energy without confirming iron deficiency can miss the real cause of fatigue and may create side effects. Taking calcium because everyone over 60 needs it may duplicate what is already in food and other products. Taking magnesium for leg cramps may not help if the real problem is circulation, nerve disease, medication effects, or dehydration. Let us make this practical. Write one sentence beside every supplement. I take this because... If you cannot finish the sentence clearly, put a question mark beside it and ask your doctor, pharmacist, or registered dietitian whether the product still has a useful role. The 4th check is what is actually inside the product. Do not rely only on the large words on the front of the bottle. Turn it around and read the supplement facts label. Look at the active ingredients, the amount per serving, and how many tablets or gummies make one serving. A bottle may display 1 capsule in the picture, while the serving size is 2, 3, or 4. Combination products deserve extra attention. A nighttime formula may contain melatonin, magnesium, valerian, passion flower, chamomile, or other ingredients. A bone product may combine calcium, vitamin D, magnesium, and vitamin K. A multivitamin may already contain some of the same nutrients. When several products overlap, the total amount can be much higher than you realize. Imagine someone who takes a multivitamin in the morning, a bone formula at dinner, and a sleep powder at night. Each label may look reasonable by itself, but all three may contain magnesium or vitamin D. The danger is not the time on the clock. It is the total exposure across the whole day. More is not automatically better. High supplemental intakes can cause side effects, and some nutrients can become harmful when taken in excessive amounts. Magnesium from supplements can cause diarrhea, nausea, and abdominal cramping. Very high amounts can affect the heart, especially when the kidneys cannot clear magnesium properly. Too much vitamin D can raise calcium levels. Excess vitamin A can harm the liver and weaken bones. Quality matters too. In the United States, dietary supplements are not approved by the Food and Drug Administration for safety and effectiveness before they reach the market, in the same way medicines are. Independent quality seals may help show that a product contains the listed ingredients and has been tested for contaminants, but a seal does not prove that the supplement is effective or appropriate for you. Be cautious with dramatic phrases such as doctor formulated, clinically proven, pharmaceutical strength, or natural sleep miracle. Those words do not replace a clear ingredient list, reliable evidence, and professional advice. Here is a simple label check. Look for duplicate ingredients, unusually large amounts, proprietary blends that hide individual amounts, and ingredients you do not recognize. Photograph the front and back labels and show them to a pharmacist. The pharmacist needs the exact product, not just the words sleep supplement or magnesium. Also, consider how the product feels in your body at night. A large tablet, acidic powder, or mineral capsule may cause nausea, reflux, or discomfort in some people, especially when taken with too little water or immediately before lying flat. Follow the label's food and fluid instructions. If swallowing tablets has become difficult, do not crush or split them unless a pharmacist confirms that the product can be altered safely. A different form may be easier and safer. The third check is what else you take during the same evening window. This is where timing becomes genuinely important. Some minerals can attach to medicines in the digestive tract and reduce how much medicine the body absorbs. The supplement may not make you feel ill, yet it can quietly make a prescription less effective. Magnesium supplements can interfere with the absorption of some osteoporosis medicines and certain antibiotics. Calcium can interact with levothyroxine, some antibiotics, and other medicines. Iron can reduce the absorption of levothyroxine and levodopa, a medicine used in Parkinson's disease and some cases of restless legs syndrome. The exact spacing depends on the medicine and the supplement. Do not guess from a general internet schedule. Read the prescription label and ask a pharmacist, how many hours should separate this medicine from calcium, iron, magnesium, or my multivitamin? This matters at night because many people place everything beside the toothbrush and swallow it together. A thyroid medicine may have been moved to bedtime. An osteoporosis medicine may have special instructions. An evening antibiotic may overlap with a mineral supplement. The routine is convenient, but convenience can reduce absorption. Herbs can create a different type of interaction. St. John's wort, sometimes sold for mood, has a high risk of interacting with medicines. It can reduce the effectiveness of important drugs, including certain heart medicines, transplant medicines, seizure medicines, anticoagulants, antidepressants, and other treatments. It may also cause serious serotonin-related effects when combined with some antidepressants. Vitamin K is another example. People taking warfarin are often told to keep vitamin K intake consistent. The issue is not that vitamin K is bad. Sudden changes in intake can affect anticoagulation control. Starting a new bone or multivitamin product that contains vitamin K should be discussed with the clinician managing warfarin. The safest habit is to keep one complete list that includes prescriptions, non-prescription medicines, vitamins, minerals, herbs, powders, gummies, teas, and oils. Write the time each one is taken. Bring the list and the actual bottles to appointments. A supplement can interact with a medicine, even when the two were purchased from completely different places. If clear, practical guidance for life after 60 is useful to you, subscribe to Herbi Diet so we can keep learning together. Now we come to the check that matters most during the hours when balance, alertness, and breathing need protection. The second check is whether the supplement adds sedation. Many nighttime products are designed to make you feel calmer or sleepier. The problem begins when the supplement is added to a prescription sleeping pill, a benzodiazepine for anxiety, an opioid pain medicine, a sedating antihistamine, alcohol, or another herbal sleep product. Melatonin may cause drowsiness, dizziness, headache, or nausea in some people, older adults may feel its effects into the next day. Valerian may have sleep-inducing effects, although evidence for chronic insomnia is inconsistent. It should not be combined casually with alcohol or sedatives. Kava can also increase sedation and has been linked with serious liver concerns. Even a mild increase in drowsiness can matter at 2 in the morning. You wake to use the bathroom, stand quickly, and discover that your balance is not as sharp as it was at bedtime. Low lighting, loose slippers, a blood pressure medicine, and a sedating supplement can all contribute to the same fall. Ask yourself 4 questions. Do I feel groggy when I stand at night? Am I less steady in the morning? Have I had a near fall? Has anyone noticed confusion, slowed speech, unusual sleepiness, or changes in breathing after I take the product? Do not prove that a product is safe by taking more, and do not combine several natural sleep aids because one did not work quickly. Natural products can still affect the nervous system. The effect can stack even when each product comes from a different bottle. Sleep supplements can also hide the real problem. If insomnia lasts for weeks, the answer may be a review for sleep apnea, restless legs, depression, anxiety, pain, reflux, medication timing, or bladder problems. Cognitive behavioral therapy for insomnia is an evidence-based approach worth discussing for ongoing insomnia because it addresses the habits and thought patterns that maintain poor sleep. If you take a prescribed sedative, anti-anxiety medicine, opioid, seizure medicine, or sleeping pill, ask a pharmacist before adding melatonin, valerian, kava, cannabidiol, or any multi-ingredient sleep blend. Do not assume that taking them several minutes apart removes the interaction. The effects can overlap for hours. The first and most important check is whether your health conditions change the safety of the supplement. A label is written for a general customer. Your body is not general. Kidney disease can change how minerals are cleared. A magnesium, potassium, or multimineral supplement that is tolerated by one person may be unsafe for someone whose kidneys do not remove excess minerals effectively. People with kidney disease should not choose mineral doses from social media or from a relative's routine. Liver disease also changes the conversation, especially with concentrated herbal products. Herbal does not mean harmless to the liver. Kava has been associated with severe liver injury. Ashwagandha has medication and condition-specific cautions, and rare liver injury has been reported. A person with liver disease should review herbal extracts carefully. Heart and blood pressure conditions matter too. Some products can lower blood pressure, raise blood pressure, affect heart rhythm, or change fluid and electrolyte balance. Vitamin D combined with certain thiazide diuretics can raise the risk of high calcium, particularly in older adults with reduced kidney function or other risk factors. Diabetes is another reason to check. Herbs marketed for blood sugar may add to the effect of diabetes medicines. The result can be low blood sugar, especially when evening food intake is small or irregular. Never reduce prescribed diabetes medicine to make room for a supplement. Bleeding risk matters when you take warfarin, apixaban, rivaroxaban, clopidogrel, aspirin, or other medicines that affect clotting. Some supplements may influence bleeding or interfere with treatment. The exact risk varies by ingredient, so the complete list must be reviewed. Surgery and procedures create one more safety window. Supplements can affect bleeding, sedation, blood pressure, or anesthesia. Tell the surgical team about every supplement well before a procedure and follow their instructions about what to pause and when. Here is the final payoff. The most important bedtime check is not, will this help me sleep? It is, does this fit safely with my entire medical picture? A supplement can be useful, unnecessary, poorly timed, duplicated, or risky depending on the person taking it. Now, let us turn all 5 checks into a simple nighttime plan. Tonight, do not add a new product just because an advertisement promises deeper sleep or more energy tomorrow. First, write the exact product name, every active ingredient, the serving size, and the reason you want to take it. Next, place it beside your full medicine list. Include prescriptions, over-the-counter products, and other supplements. Mark which ones are taken within the same 3 or 4 hour evening period. Do not create your own spacing rule. Use the list to ask a pharmacist what needs separation. Then, review your conditions. Write down kidney disease, liver disease, diabetes, blood pressure problems, heart rhythm problems, bleeding disorders, glaucoma, urinary problems, dementia, seizures, allergies, and upcoming surgery. These details can change the answer. Ask 5 questions at the pharmacy or clinic. Do I need this supplement? Is the amount appropriate? Does it duplicate anything else? Does it interact with my medicines or health conditions? What time and method of taking it are safest for me? When a supplement is approved for you, add only one new product at a time. Keep the original container. Record the date you started it and any changes in sleep, digestion, alertness, balance, skin, breathing, heart rate, or blood sugar. This makes it easier to identify a reaction. Seek urgent medical help for trouble breathing, swelling of the face or throat, fainting, severe confusion, a seizure, chest pain, a very fast or irregular heartbeat, severe weakness, vomiting blood, black stools, or symptoms of dangerously low blood sugar. If a serious reaction begins after a supplement, bring the container or a clear photo of the label with you. For less urgent problems such as persistent diarrhea, new constipation, morning grogginess, dizziness, rash, or unusual bruising, contact a health professional for advice. If the product was newly added and was not prescribed, ask whether it should be paused. If it was medically prescribed, contact the prescriber promptly before changing the plan. Remember the 5 checks. Know why you are taking it. Read everything inside it. Compare it with every evening medicine. Watch for added sedation. And check whether your kidney, liver, heart, diabetes, bleeding risk, or planned procedure changes the safety. Which check will you do first tonight? The purpose, the label, the interaction list, the sedation check, or the health condition review? Tell us one word in the comments. Subscribe to Herbi Diet for calm, evidence-aware guidance about supplements, nutrition, sleep, and healthy aging after 60. Share this with someone who keeps several bottles beside the bed and assumes that taking them together is always harmless. A helpful next topic would be how to create a one-page medicine and supplement list that a doctor or pharmacist can review in less than 2 minutes. This video provides general education, not personal medical advice. Supplements can be useful, but the right product, amount, and timing depend on your health and medicines. Check with your doctor or pharmacist before starting a new supplement, especially if you take prescriptions, have a chronic condition, or are preparing for surgery. The safest bedtime routine is not the one with the most bottles. It is the one that has been checked carefully.